Our treatment methods allow children with various severe pathologies to be discharged. This is a syndrome of respiratory disorders, edema and severe jaundice, a form of hemolytic disease of newborns, non-immune dropsy of the fetus, as well as profoundly premature babies. The neonatal intensive care unit was one of the first to implement the kangaroo method for weaning premature babies. Our experts recommend ensuring skin-to-skin contact between a newborn and an adult, the so-called kangaroo exit method, immediately after birth, without first placing the baby in an incubator. This is explained by the fact that the possibility of close and inseparable contact of a premature baby with a close adult after birth has a huge positive value for the health of the child. We also provide recommendations for providing emotional support and labor adaptation services to families in which extremely low weight and premature babies are born. As such, families often experience great stress and difficulties, faced with the need to intensively care for the baby and worry about his health. An estimated 15 million babies, or more than 1/10 of all newborns worldwide, are born prematurely each year, and even more children, more than 20 million, have low birth weight. This rate is increasing, and prematurity is now the leading cause of death for children under the age of 5. A premature baby's chances of survival still vary widely depending on the place of birth. While in high-income countries most babies born at 28 weeks or later survive, in poorer countries survival rates are sometimes as low as 10%. In most cases, a premature baby can be saved with easy-to-implement and cost-effective methods that include quality care before, during and after birth, prevention and treatment of common infections, and kangaroo weaning, which involves keeping the baby in skin-to-skin contact for as long as possible. Special transfer or diapering with the closest adult, usually the mother, in combination with exclusive breastfeeding. Premature babies do not have sufficient reserves of body fat and often have problems with independent thermoregulation after birth. They also often require respiratory support. Previously, it was recommended to separate such babies for the first time to stabilize their condition in an incubator or under a heater. However, research now shows that kangaroo weaning, started immediately after birth, saves more lives, reduces the incidence of infections and hypothermia, and improves feeding rates. To improve the health of premature and low birth weight newborns, breastfeeding is consistently recommended, as there is evidence that breastfeeding, unlike infant formulas, reduces the risk of infections. Donor milk is the best alternative if the mother does not have milk, but where there are no banks of donor milk, it is allowed to use nutrient-enriched special milk formulas for premature babies. The department has extensive and positive experience of cooperation with the Medical Center of Children's Cardiology and Cardiac Surgery. Our specialists study on improvement courses at the bases of neonatology departments. Over the years of the Perinatal Center's existence, more than 6,000 lives of newborns have been saved in the intensive care unit. More than 500 children receive treatment annually.